So, in your collaboration with, kind of healthcare clients, healthcare companies, what is kind of your process to get on paper what they're looking for? Does it all start with, all right, how many providers? And then we build around that. That's very oversimplified, I'm sure. But, what does your guys' process kind of look like? How do you start that?
How do we start it? We listen.
Okay. Yeah.
That's the first
Great
problem
answer.
solvers.
Yes.
We listen. So the first step always is trying to talk to the providers and their key personnel and seeing what are their needs, like you said, exam rooms and whatnot, and just kind of being able to help them get it out on a paper, and then we can help them analyze, what their the wants and the needs and the relationships are, and just putting it down, asking them what their past experiences are from their previous places or whatever, and what do they envision having in their new space. Again, just don't be shy, just talk.
Right.
Nothing at that point is unachievable. It's just telling us whatever thoughts you have. Once we have that, basically at that point, once we get the relationships done, it's all established. At that point, all we have to do is solve the problem. Like I said earlier.
Right.
And we always think, or we'd like to think that we take care of our clients' clients. That's something that we try to follow through on the fact that even though our client may be the particular healthcare provider, we're looking to their clients. To make sure that we're thinking about the end user, because a positive experience is only going to benefit the healthcare provider to begin with. So from that standpoint, we do, since we do this day in, day out, we do try to bring all the collective experiences we've had with the different types of healthcare operations or disabilities or different circumstances, and bring all that experience to specific providers to collaborate with them and find what's going to work best for them and their clients.
Yeah, that's pretty cool. Build for or design for your clients' clients.
Correct.
Ultimately, that's who's using it, right? It makes a whole lot of sense.
How does it differ from working with a group that's, maybe they have, 10 or 15 locations versus somebody that's brand new? Like, how does that approach?
It does differ in a way, like I was saying earlier, if they have any experience or not. So if they already have some locations, we still like to go see and walk those locations in person and walk with the office manager, walk with the provider, try to find a time where we're not disturbing their everyday process, but almost like walk me through like a patient walks through. So we'll see what they see and also see what happens as the inner workings that are going on over there, right? So if they have those previous locations, they can tell us what works for them and what doesn't. Sometimes that's just as important as finding out what works, because a couple of our clients, they loved their check-in, check-out flow, but they just did not like how the clients moved through diagnostics. And we were like, okay, just let us know what's not working so we can resolve that or try to figure out a different way of it. If they don't have any prior locations, what I think we bring to the table is our experience with other facilities and throughout the years that we have worked with. And we are able to kind of guide them through a little bit through design, sinks and exam rooms. How many exam rooms do you need? Is the waiting plenty or enough or not? How many patients are going to circle and cycle through in a day? Just those kind of questions that they might not think about, either letting the architect know. We ask questions, and you guys know
they don't even know that they need to be asking.
Right.
Exactly. And you know me, I ask a lot of questions.
Yeah.
Yes.
And so also me growing up, on a personal note, growing up with a family with doctors, our dinner table talks used to be that, right? How did the surgery go, or what happened? Were they running late for this or that? That just helps have an inside perspective to what the providers may want or think. Like, hey, do you want sometimes a backdoor approach because you are running late in a surgery. Some, life-threatening event happened or whatever. They're not there on their own accord. They're late, but it's a very demanding profession.
Absolutely.
Sure.
So definitely we got to allow for those things and still see how we can move. So that having that, I guess, a connection, I kind of, I don't know, not empathize, but I kind of connect with them, the providers, easily on that sense, on a personal level, just growing up around that.
Yeah.
Yeah.
Gives you some of the insight.
Yeah.
Connecting, listening, understanding, and that's what, like, to your point about customer service, it does go back to that, because these doctors are serving patients and people who are, like I said, often they're coming in when they don't want to be seeing doctors. So how do you make that more of a comfortable overall environment? So no, I do like that. And I mean, around that though, as far as challenges within designing healthcare, because we do have some additional regulations we have to be aware of. But how does that, some of these challenges to overcome, like how do you just think about, like, you mentioned before, right? Because you've done so many of these primary care type facilities, you just know what's going to be, what they're going to need before they even know it, or some things to consider, like the sinks. There's always a toss up. We see good amount of clinics with sinks, good amount of clinics without them.
Sinks.
And like on the construction side, there's an added cost, because now you got to have a sanitary line and somewhere
Suck up
for
the
that
slab
sink.
And trench it.
So those are the things